Hi, I'm Dr. Sebastian Gonzalez. This video today is going to be basically on some hip issues in here, more in competitive athletes. We have someone here helping us today, so at least you guys can get a good visual of basically the problems that she's going to be having. This video is mainly intended for educational purposes, and I'm not going to go over a ton on how to strengthen it or how to stretch it out because there's tons of stuff on YouTube already on that. Typical history with this, and the area we're going to be looking is mainly in here. You know, this person actually, they were somebody that was not going to get therapy or treatment done of any sort until actually they started running through the injury and they started noticing it was just an abnormal feeling. They told their coach, the coach kind of put them down for about a week or so, and after that I was able to see her. And she's responded really well since then. I think it's been about maybe a month now. She hasn't had too many reoccurring things. The main thing with hips is you have to figure out differentiating to figure out exactly what the person's feeling. I would start with bony landmarks. Basically look up, if you're coming up here, you have the iliac crest. You can cross-reference these on some of the netters books or stuff on the internet. So the iliac crest is kind of like the borderline between the abdominal region and then the actual hip. Everything kind of below from here, from this region right here, actually there's not a lot below it. There's not actually a joint below it. The hip joint itself is down here. So the muscles in this area is the gluteus medius, gluteus maximus, the minimus, and a lot of times what I've seen, especially in people like her, is that you get development of these overuse and scar tissue, basically areas where the muscle's been traumatized either from overuse, overtraining, gait abnormalities. Tons of things can cause this, but basically there's an area where the tendon becomes muscle, so the musculotendinous junction, and some of this scar tissue develops. Essentially, it's like it's like an analogy of like a rope you would put around a corner, really jagged corner, it would just get frayed up. The body deposits normal stuff in there to make it so it heals, yet it becomes less elastic, and essentially it becomes less stretchy as well. The technique I prefer to use with working on these areas, especially in the musculotendinous junction, is called active release technique, or ART. It's basically a very specific form of tissue work where you find the correct spot by talking to the person, also feeling what the muscle fibers are doing, and you would bring them basically into ideally an active range of motion while you're holding the spot. I tend to think it's very different than just digging in and doing circular patterns and stuff like that. That stuff is all good, but I tend to think things work differently on varying degrees of effectiveness, and I think this is one of the most effective things that I have found. After that, strengthening the area is super important, so it's always important to talk to the coach about that as well. The rehab process, after you really address some of these issues, is mainly going to revolve around strengthening of the pelvis area, as well as doing some stretching on things like a baseball or foam roller to basically break up some of the scarring that you could potentially have in there. It's important to talk to the coach's athlete as well to figure out what's important in their schedule coming up, because obviously you don't want to focus on rehab-based stuff right before their events. Thanks for watching, and I hope if you guys have any more questions, feel free to contact me on my website. Don't forget to check out our ebook as well.